These colder months are generally when we see an uptick in strep throat, but a warning today about a record number of aggressive and even deadly Strep A infections across Canada. As CTV's Annie Bergeron-Oliver reports, the largest increases are being seen in children.
Hospitals across Canada are dealing with more invasive Strep A cases than ever before, especially among children under 18.
It can have significant consequences, including death. So we really need to pay attention to this.
Last year, there were more than 4,600 cases of invasive Strep A in Canada, the highest public health has ever recorded. There's normally between 2,000 and 3,000 cases reported annually.
Some days I wake up and I think it didn't happen.
Christina Hectus's 5-year-old daughter, Quinn Henderson, contracted the bacteria in March 2023. For 2 days, Hectus was told the little girl likely had a cold. On the third day, she was admitted to hospital and died 12 hours later.
To see your little one with so much life and so much promise, and then they're gone.
Health Canada says most illnesses caused by the Streptococcus bacteria, including strep throat, are mild and treatable with antibiotics. But in rare cases, the bacteria becomes invasive and enters the bloodstream or deep tissues. When that happens, serious life-threatening illnesses can happen, including meningitis, toxic shock, and sepsis.
It's a combination of the bug and the host, and why does it happen in some and not in others really is much more of a mystery.
Sean Sisk's infection started with a fever but deteriorated quickly.
I felt like I had a bit of a cold, like nothing serious. And my body was shutting down.
He was in a coma for 6 weeks with flesh-eating disease. He says it was likely caused by the Strep A bacteria entering a cut in his leg.
If my wife hadn't called an ambulance, I probably would have died. Like if I was in the hospital at 5:30 in the morning. They had me intubated by 11:30 in the morning.
There is no vaccine for Strep A, but doctors say that keeping up with regular practices, including hand washing and staying home when you're sick, as well as staying up to date on routine vaccines, including flu and COVID shots, Omar, can help.
All right, some good advice, Annie. Thank you.